We now go to our reporter Laura Windsor for some insight into cerebral palsy.
Cerebral palsy is a group of disorders that affects a person's ability to move and maintain balance and posture. The CDC estimates that about 1 in 300 children in the United States has cerebral palsy. Dr. Samuel Rosenfeld, a pediatric orthopedic surgeon at Chalk Children's Hospital, examines the symptoms to be aware of if you suspect your child is having developmental problems.
Cerebral palsy involves injuries to the brain and nervous system that are not progressive. They are injuries for which the brain can have recovery from. So these are all conditions that result in some neurologic deficits that should gradually improve. And cerebral palsy usually refers to those events or injuries taking place up till about age 5 years. And then beyond that, they're referred to as just acquired brain injuries. Injury is anything that will damage the nervous system. And the most common causes are congenital malformations, where the brain isn't formed normally from the beginning, and then any event that causes loss of circulation, loss of oxygen to the brain tissues, causing damage. The diagnosis is made by, first of all, finding a neurologic problem, and then understanding the temporal sequence. When did it start, and where is it going? Is it getting better? Is it getting worse? The diagnosis of cerebral palsy is only on a condition that is improving, that is not getting worse. The symptoms are directly related to the area of the neurologic injury. Depending on what part of the brain is injured or part of the spinal cord that is injured, depends on the symptoms that you see. If I'm an orthopedic surgeon and my goals are to rehabilitate the children and maximize their function, so when a child comes to me, often they will not even have the diagnosis of cerebral palsy. They'll present to me as toe walking or not using one hand equal to the other hand. They can be very subtle things, and on a good examination you can pick up where the neurologic problem is. And if, again, by the history, whether this is something that has been there since birth or there for a while and is actually getting better, but is still becoming an impairment for the child. The treatment for cerebral palsy is really interdisciplinary. We use medications, we use therapy, we use bracing, we use surgery. And within each of those categories, there's different types of treatments that are used. So it's very individualized for the child. There isn't one treatment for any child. It's a combination of these things. The surgical techniques have been sophisticated. The medications are much better. The therapy techniques continue to be refined. Our orthotic materials that we're using for bracing have significantly improved. So there's a lot of advances on each of those components of treatment that we use. And the goal with cerebral palsy is for 100% improvement. And I think that cerebral palsy is actually a good diagnosis because it first of all, it means that the child is going to be improving from where they started. And secondly, there are a number of resources in the community that open up with that diagnosis. It becomes a magical diagnosis for getting children into preschool early, getting school districts to evaluate them psychologically, and look for the learning disabilities which are sometimes associated with cerebral palsy. So an early diagnosis is actually a good diagnosis on a child that has some physical impairment.
Maintaining regular checkups for your child will ensure early detection of any disease or condition, especially cerebral palsy. For the American Health Journal, I'm Laura Windsor.